Hello, doctors. This is Dr. Baliga. This podcast belongs to a group of 11 podcasts on asthma, derived from an outstanding chapter in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Christopher H. Fanta, MD, who is the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and Mass General Hospitals and affiliated community hospitals in the Boston area. He is a member of the Pulmonary and Critical Care Division at the Brigham and Women's Hospital and a full professor of medicine at Harvard Medical School. He is the co-author of the Harvard Medical School Guide to Take Control of Asthma, published by Simon & Schuster in 2004, and the Asthma Educator's Handbook, published by McGraw-Hill in 2007. After listening to this series of podcasts, the listener should have a solid foundation on the topic of bronchial asthma. Multiple choice question. A patient with asthma complains of intermittent hoarse voice. The medication most likely to be causing the symptom is A. The cystinyl leukotriene receptor blocker montelukast. B. The inhaled long-acting beta agonist formoterol. C. The anti-immunoglobulin E monoclonal antibody omalizumab. And D. The inhaled steroid fluticasone. And the answer is D. Intermittent hoarseness and dysphonia are common side effects of inhaled steroids. The mechanism likely relates to laryngeal deposition of the inhaled medication with consequent reversible changes in the tissue. The symptom typically resolves with the cessation of the medication, sometimes changing to a different steroid preparation or a different method of delivery, example from dry powder inhaler to metered dose inhaler with valved holding chamber can help. The leukotriene receptor antagonists, the long-acting inhaled beta agonists, and omalizumab do not cause this side effect. This podcast was derived from an outstanding chapter on asthma authored by Dr. Chris Fanta, MD, who is a professor of medicine at Harvard Medical School, and he's the director of the Partners Asthma Center, a collaboration of allergists and pulmonologists at the Brigham and Women's Hospital and the Mass General Hospital and the affiliated community hospitals in the Boston area. He's the co-author of the Harvard Medical School Guide in Taking Control of Asthma and the Asthma Educator's Handbook. This chapter was derived from Baliga's textbook of internal medicine, available at www.mastermedfacts.com. After listening to the 11 podcasts on this topic, the listener should have a solid foundation in asthma.